So, we get a lot of questions with LASIK surgery about dry eye and how that kind of affects things after surgery. And that is one of the most common symptoms we see after LASIK surgery is a post-operative dry eye. Well, the key thing, first of all, is just having a real careful exam prior to LASIK surgery. And if you're dealing with dry eye issues to begin with, we really want to get that under control. So we want to make sure your eyes aren't too dry going into the procedure. And that involves a careful assessment. We do have a dry eye clinic, which will sometimes put patients through prior to surgery just to kind of prepare their eyes for surgery in case we know that the dry eye is going to get worse post-LASIK surgery. Now, if someone is experiencing dry eye post-LASIK and they're more symptomatic, again, we can refer to our dry eye clinic where we can manage things medically. There's certain procedures we can do to improve the quality and the health of their tear film. But there's careful examinations we do a week, a month, a few months after surgery to look at the ocular surface to make sure things are healing well. With LASIK surgery, the dry eye tends to be temporary. It's usually worse the first 3 weeks or so. So oftentimes we're just counseling patients, you're going to be using preservative-free tears every couple hours. You want to manage your computer use and reading to some degree, and it's just kind of getting through that. For those patients who maybe have more prominent dry eye, again, we can be more aggressive with anti-inflammatory drops. And then one of our specialists is a dry eye specialist, Dr. Reardon, in our practice, and that's kind of her thing as far as helping us manage the patients that may be having more significant dry eye prior or even after LASIK surgery. So we're really able to get patients through that very well, so it's really not a long-term concern. And then after 2-3 months, tear production returns back to baseline, so we don't expect long-term sequelae of dry eye from LASIK surgery. I think the key thing is, so if we see somebody with a pretty significant dry eye in the preoperative setting, they come in for an exam, we notice their eyes are dry, we're not going to rush in and recommend surgery until we really tuned up the surface of the eye. So we really want to kind of go into a procedure with maximum health of the eye, and that just that really ensures a more successful outcome. So, and then, some patients with more extreme dry eye, they may not be the best candidate, and we also have that discussion as well. So the goal really is to do kind of what's best for the eyes and not stress the eyes out too much.